Hello, good morning everyone. So today I will be teaching carrying of a Tenckhoff catheter and peritoneal dialysis education. So for my target audience, I will be invite those patients who are on peritoneal dialysis and have some basic understanding on what is PD is and their caregiver as well. So estimation about 10 participants to join this session. So for the resources wise, you'll be using some of the visual aids like diagrams, presentation slides and video to explain purpose and function of the Tenckhoff catheter is, some of the sterile dressing kit and mannequin for the demonstration and practices later. Aim of these teaching sessions, which is to educate individuals with the Tenckhoff catheter on how to have a proper care and maintenance of the catheter is, to emphasizing the infection prevention. So by end of these sessions, participants will be able to understand well the purpose and the function of the Tenckhoff catheter is, able to identify the signs and symptoms of the catheter related complication as well. So they demonstrate the proper technique on cleaning, flushing, dressing the catheter acid site as well. So the whole structure of these teaching sessions, it will be firstly go by the icebreaker activity, engage participants in a brief activity to create a positive environment, such as like sharing their PD journey between the participants. Secondly, will be assess the prior knowledge. Will be conducting a brief discussion on how well does the participant understanding on the peritoneal dialysis is, like how does this peritoneal dialysis work, what is the advantage of it. So the whole learning activities, which is we're using the mini presentation slide, which is what is peritoneal dialysis, and then how does the PD work, of course like types of the PD like CAPD and APD, and then benefit of the PD as well. So secondly, which is engage participant in the discussions on what is the common risk of the related to the peritoneal dialysis. Like we encourage participants to share their personal experience and the strategy on how they manage the complications or how they prevent it. After that, we'll summarize the key risks of the importance of the complications of the peritoneal dialysis. Next, following which is the demonstration and practices, will be demonstrate the sterile dressing change technique using a dressing kit on a mannequin as well. Like example, circulation method to check the acid site whether got any pus, whether it's clean or not. Yeah. And then allow the participants to hands-on on the mannequin to practice the dressing changes and then stimulate the step-by-step by using the instructions given. So the next one, which is the peritoneal dialysis diet, which is we're using some of the visual aids, like example, PD diet. Fluid restriction is very important to prevent from fluid overload, and then some of the monitor of the electrolyte level also, like example potassium, sodium and phosphorus, to optimize the participants overall health. So the next one, which is a Q&A sessions, so will be address any participants questions or any concern that they have related to the Tenckhoff catheter care. So the conclusion wise will be a short summary and key takeaways. Will be recap the whole main point that we had discussed through the teaching sessions, and then emphasizing the importance of the proper care of the Tenckhoff catheter is and the infection prevention. So of course, the lastly is the assessment of the learning outcome. Will be a self-assessment questions. Provide participant with some question to assess how well does their understanding of the presented material and how well does the effectiveness of these sessions for them. Thank you.